introduce you to the proceeding of events. Firstly, I heartily welcome of NTAI National and NTAI Punjab and other branches too, followed by very warm welcome of our chief guest moderator Dr. Ramanjit Kaur and resources person Dr. Parvez Saini and the webinar audience. Here I feel delighted to announce that Punjab NTAI organizing their first webinar on World Osteoporosis Day. World Osteoporosis Day was launched on 20 October 1996 by the United Kingdom National Osteoporosis Society for raising global awareness of the prevention, diagnosis, and treatment of osteoporosis and metabolic bone disease. Before starting the webinar, let's thank Almighty God in the way of prayer by Miss Mandeep Kaur, Associate Professor, Nightingale College of Nursing, Naranwal, Ludhiana, Punjab. Please, ma'am.
Thank you, Surinder ma'am. Thank you for giving me a chance to praise Almighty God.
Thank you, ma'am, for the prayer. Now, without further ado, for inaugural address, I will turn the time over to Dr. Hardeep Kaur, President of Punjab NTAI. Ma'am is an professor cum principal, University College of Nursing, Baba Farid University Health Sciences, Faridkot, Punjab. Ma'am, please take the control.
Thanks, Surinder.
Welcome.
State, National Punjab State Executives and my friends from the nursing profession, distinguished participants, I feel the immense pleasure to welcome you all and to just announce the first webinar which has been organized under NTI State, Punjab State Association. And this webinar is organized on the event of World Osteoporosis Day, as the Surinder has already told us. And this Osteoporosis Day, which is celebrated on 20th of October every year globally. And this year, the theme for this World Osteoporosis Day is like the step up for bone health. And this theme, this appeals the global healthcare professionals, organizers, and the stakeholders just to provide the opportunities and facilities for everyone so that the osteoporotic patients, they can avail timely diagnosis and timely management and just to avoid the torments of osteoporosis and its complications, and they can live quality life. So to highlight on the topic of osteoporosis, we have with us our eminent speaker, Dr. Parvez Saini. She is principal at Shri Guru Ramdas College of Nursing, Shri Amritsar. I welcome you, ma'am. Ma'am has vast experience of more than 2 decades, and she has agreed to be part of this webinar without giving a single thought. And I'm very much confident that with her expertise talk, we all will be benefited. I just pay my special regards to Dr. Ramanjeet, Vice Principal cum Professor, and she is a moderator of scientific event of this webinar. Thanks and welcome to the NTI National Executive members, especially Dr. Farooq Khan, Madam Poonam, Mr. Manish Kumar, and the other state executives like Mr. Purushottam Kumbhas. He is part of this webinar. I am very happy to see those names in the webinar. And we are delighted to be just organizing this webinar with their presence. And they always increase all of us, and NTA's national level executives, they have given the technical support to organizing this webinar and to make it a success. And I hope this webinar you all enjoy, and thanks for joining and have a good time. Thanks.
Thank you, Dr. Hardeep Kaur. Now I am requesting to our chief guest, Dr. Farooq Khan, to share their views regarding to the webinar. Dr. Farooq Khan, Professor cum Principal, the Academy of Nursing Sciences and Hospital, Gwalior, MP. Please, sir, take the control.
Yeah, good evening, one and all present over here on this virtual platform. Actually, sorry for that. I have not reached at home. I'm somewhere else. But first of all, I would like to congratulate all the organizing team members of Punjab State Branch that today they are organizing first webinar. And that is very appropriate topic they have selected. And today is a World Osteoporosis Day. That today we are organizing the same day, the thing. And we know that all the day, what we used to celebrate, it provide the information that we must aware on the same disease condition what we are celebrating. Means World Osteoporosis Day means we have to aware regarding the osteoporosis. And by the God grace that we are having a very eminent resource personality, Dr. Parvez Saini ma'am, Professor cum Principal, Shri Guru Ramdas College of Nursing. So I think so all the participants and all the nursing fraternity will get the benefit today by the eminent personality. And I congratulate all the organizing committee members, especially Dr. Hardeep Kaur ma'am, State President, NTI State Branch of Punjab State, and Dr. Swapna madam, Dr. Ravi Prakash Saxena sir, State Secretary, Swapna madam, State Vice President, Ravinder Kaur madam, State Advisory, and Miss Mandeep Kaur, State Joint Secretary, Miss Manjot Kaur ma'am, and all the Surinder Kaur Grewal madam, and all the organizing committee members. Maybe I am the name. Sorry for that. I have not taken all the names. And all the best participants that today definitely we will get the new knowledge, and we will update our knowledge regarding the osteoporosis. And I hope our Punjab NTI branch next webinar also will get select eminent or emerging topic for next webinar. So all the best to all the organizing team members, all the best to the participants. Thank you.
Thank you, sir, for your valuable opinions. Followed by this, for introduction and glimpse of NTI Let's turn the mic over to our next speaker, Professor Ravi Prakash Saxena, Professor cum Vice Principal, SGL Nursing College, Semi Jalandhar, Punjab. Sir, please take the control.
Thank you, Surendra ma'am.
Welcome, sir.
Good evening, everyone. I extend my warm welcome to all on this first webinar organized by NTI Punjab State Branch. And it's my immense pleasure to introduce the Nursing Teacher Association. I will be sharing some glimpse of this, whatever they have organized the events in the past. First of all, I would like to introduce myself. I'm Ravi Prakash Saxena and working as a Vice Principal, HOD Community Health Nursing in SGL Nursing College, Sami Jalandhar. Now, next, I'm introducing regarding Nursing Teacher Association of India, and I think most of the participants they will be not aware about this association. So I thought to introduce uh, everything regarding this association. The Nursing Teacher Association was established in January 2019 with a goal of bringing nursing teachers from all over the world together. And the Nursing Teacher Association is registered society under Society Act 1973 and affiliated to Commonwealth Nurses and Midwives Federation London, United Kingdom. Today, just after 3 years, Nursing Teacher Association is having many members, belongs to every state in India who are working with the NTI to fulfill to fulfillment of the nursing fraternity, especially in nursing education. Joint efforts of all executive members of NTI made things done with the extending NTI branches in almost all the states as well as union territories of India. NTA saw a dream of this association, and now the dream is getting true by endless efforts of all the team members. Next, visions and the mission of NTAI. So, vision and mission is to create growth and impact in all the aspects of nursing education around the world. Next is the objectives. So, first objective is to promote the advancement of all aspects of nursing profession. Second objective is to make arrangement of conference, synopsis, seminar, workshop at state level, national level, and international level to promote for the continued professional development of nursing teachers and to publish periodically journals, newsletter, magazines, etc. Fifth objective is to encourage the free exchange of educational and professional ideas within the association. Next objective is to promote professional counseling and placement services for the nursing teachers. Next objective is to encourage nursing teachers by rewarding as per norms of association. Next objective is to promote charitable, cultural, spiritual, educational, and many other activities such as health camp, blood donation camp, etc. And last objective is to raise the funds by contribution, subscriptions, levies, donation, investment, and otherwise for the attainment of above objectives. Next, I'm going to introduce pillars of strength of NPI. That is all national executive members. So first, I'm introducing a very dynamic person, distinguished personality, To honor us with his presence today, Dr. Farooq Khan, National President NTI, Principal Academic of Nursing Sciences and Hospital, Gwalior. Next, dynamic person and distinguished personality to honor Dr. Manish Kumar, National General Secretary, NTI. He is currently, sir, is working as a director, KS Group of College, Gwalior, Madhya Pradesh. And next eminent person and pillar of this NTAI is Professor Poonam Thakur. She is National Treasurer NTAI. At present, Madam is HOD, OBC Nursing, and she is working in Academic of Nursing Sciences and Hospital, Gwalior, Madhya Pradesh. Next, I'm going to tell about the elected members of NTI Punjab State Branch, and everyone knows about the Dr. Hardeep Kaur, Madam. She is principal and University College of Nursing, Faridkot. And our vice president is Dr. Swapna. Madam is working at Mondai Hospital, College of Nursing, Ludhiana, Punjab. And next, General Secretary, that is myself. And next one is Professor Ravinder Kaur. She is advisor and at present she is working in SGL Nursing College, Semi Jalandhar as a HOD Mental Health Nursing. And next one is the Miss Mandeep Kaur. She is Joint Secretary and at present she is working in Nightingale College of Nursing, Ludhiana, Punjab. And our treasurer is Miss Manjot Kaur. And Manjot Kaur ma'am is working in Shaheed Kartar Singh Saraba College of Nursing, Ludhiana, Punjab. We are having a media and spokesperson, that is Miss Surinder Kaur, and she is working in Nightingale College of Nursing, Ludhiana, Punjab. Next, we are having Dr. Taran Preet, ma'am, Journal President. She's at present she is principal. She is working in Baba Banda Bahadur College of Nursing, Faridkot, Punjab. Next, Journal President is Miss Neetu Thakur, and she is working in Mata Mohan Dai Oswal College of Nursing, Punjab. Next Journal President is Mr. Ashish Matthew, and at present he is working in CKD International Nursing College, Amritsar, and he is Associate Professor. And our last Journal President is Miss Kiran Bala, and she is working in KC College of Nursing, Nawashehar, Punjab, and she is nursing tutor. Next, I'm going to tell you about the percentage-wise membership detail. So as you can see here, the percentage-wise, all the state have been covered, and many members have been joined this NTAI. Especially the number of participants or number of members are from Rajasthan, Madhya Pradesh, Chhattisgarh, Odisha, UP, and Karnataka. So maximum number of member they have joined from these states, and all the states day by day we are increasing in the numbers. Next, this is the slide for the percentage wise educational details, qualification details of NTI members. So maximum 42% are MSc nursing who have completed their MSc nursing, and they are lifetime member of this NTA. Followed by 23.7% are PhD nursing scholar, 11.50 are PhD, and 8.9 are BSc nursing, and minimum we are having 0.31% MPhil. So here I'm showing this events which was organized by the NTI or under the NTI or in the collaboration with the NTI. So here I'm showing some pictures or newspapers coverage. So from 2019 onwards, they have organized many webinars, and this was the latest. They have organized the Best Nursing Teachers Award in 2022, which was organized by NTI on 5th September 2022. Now, who can be a member of NTA? So any nursing teacher professionals, whether it is graduate, postgraduate, doctorate in nursing, they can join, or registered BSc nursing tutor, they can also join, or they can also be a member of NTA. So these are the important links, how you can follow the NTA at the national level. So here on the top, I have given this website. You can go and check the website. All the details will be given there. And this is the YouTube channel. If you go on YouTube and you will search Nursing Teacher Association, you will find out this YouTube channel. And even if you'll go on Facebook and you will type the Nursing Teacher Association of India, you will find out the Facebook page of NTAI. And even you can contact with the email address, which is given here, Gmail. And same way you can follow the NTI Punjab State branch. So here I have mentioned the Gmail address and Twitter account and Facebook page. So if you'll write NTI Punjab State branch on Facebook, you will get the page. Here, one small association with the big dreams. So some future perspectives is there. So in future, what we are going to do, that is mentioned in these 4 points. First point is the NTI is planning to release ebook app with the collaboration with the Book Era Publication and Microsoft company. Second, NTI is about to launch nursing directory. So you will get contact numbers, detail, everything you will get in this directory. NTI is planning to organize more series of webinar in other states. As I have shown you the chart, and you must be knowing that other states means all the states, around 31 states, they have already joined, and many states are coming to join this NTI. NTI is planning to develop tele-counseling health team. So these are the four future perspectives. Thank you so much for listening me, and I would like to thank all the participants who were listening, and also I would like to thank to Dr. Farooq Khan, National President, and Dr. Manish, then General Secretary, and Ms. Poonam Thakur, who is National Treasurer, and also Dr. Hadeep Kaur ma'am, who is the President of NTI Punjab State Branch. Thank you so much for listening me. And now I think your doubts will be clear for this NTI, what they are and what they are doing. So next, I would like to request Dr. Raman to come forward and start the scientific session. Dr. Raman is the moderator of this event, and she is professor cum vice principal in Shri Guru Ramdas College of Nursing, Hoshiarpur. So now she will be taking over all these things, and she will be continuing with our resource person. Thank you.
Thank you,
Thank you.
sir. Thank you, sir, for this nice introduction. Firstly, a very good evening, everyone, and welcome to this scientific session. It's an honor to have the opportunity to address such a distinguished audience. So let me introduce myself. I am Dr. Ramanji, specialized in psychiatric and mental health nursing. Currently, I am working as a professor cum vice principal at Shri Guru Ramdas College of Nursing, Hoshiarpur. I have been working with this organization since 2010 under the guidance of respected Madam Devinder Kaur Aulak, Chairperson and Managing Director, and Dr. Dimple Sandhu, Principal, Shri Guru Ramdas College of Nursing, Hoshiarpur. I am always blessed and thankful for their continuous support and motivation. Furthermore, I would like to express my sincere gratitude towards our National President of NTI, Mr. Dr. Farooq Khan, President of Punjab NTI, Dr. Mrs. Hardeep Kaur, and entire team of NTI for showing their belief in me and giving me such a wonderful opportunity to participate in this webinar. Thank you, sir, and thank you, ma'am. It's my great pleasure to introduce our today's resource person who hardly needs an introduction because of her famous personality, one and only Dr. Mrs. Parvesh Saini. She is professor cum principal at Shri Guru Ramdas College of Nursing, Valna, Shri Amritsar. If I talk about her life achievements, she has completed her doctorate degree in 2016 from Himalayan University. She is specialized in maternal and child health nursing in 1993 from CMC College of Nursing as well. Along with this, she has 29 years of working experience. She has acted as chairperson, resource person, and also guest lecturer in more than 30 scientific sessions. Also, she has organized and participated in various workshops, conferences, and seminars. Apart from this, 20 papers in various national and international journals of nursing has been published by ma'am. She has also received a Lifetime Achievement Award by Nursing Scholar Society in 2021. Additionally, appreciation certificate and cash prize has been given to ma'am on enrollment of nursing students from TNI New Delhi in different years. Last but not least, she is an author of 4 books and has life membership of TNI, NRSI, SOMI, and Indian Association of Maternal and Child Health. Ma'am, on behalf of my entire team, I would like to congratulate and acknowledge the tremendous success you have achieved. We are so grateful to have someone like you with us today. Thank you, ma'am. So before handing over to ma'am, I would like to give you few instructions to our respected audience. Firstly, I request everyone to keep their mics mute during the session. Secondly, if anyone has any query, they can drop it in the chat box, which is appearing on their screens. Thirdly, all the queries will be answered at the end of the session. And finally, we have also shared feedback link in the chat box. So please, at the end of the webinar, fill this feedback form, which will be really helpful for us for the future webinars. So I hope everyone will cooperate during the session. Now, without taking much more time, I am handing over to respected Dr. Parvesh Saini ma'am, who will enlighten us about today's scientific session. Please, ma'am.
Thank you. Thank you very much for a nice introduction. And I would like to thank all the NTA team for providing me this opportunity to deliver a lecture on this webinar on osteoporosis on very osteoporosis day. So thank you so much. So let me first, next slide, please. So what is osteoporosis? So introduction, it's as we already know that it's a silent disease because it doesn't have any sign and symptom, but only it come to your attention after you have a after you broke your bone. So when you have this condition, a fracture can occur even after a minor injury, such as fall or even when you sneeze or cough. So osteoporosis is not an inevitable part of aging. It's a disease that can be prevented and treated, provided it is detected at early stage. The main goal of treating osteoporosis is to prevent fracture in the first place. So next slide. These slides are hindering in between. So can I remove these? So as far as the definition is concerned, so osteoporosis is a progressive systemic skeletal disease characterized by reduced bone mass and density and microarchitectural deterioration of bone tissues. A disease characterized by low bone mass and structural deterioration of bone tissues leads to susceptibility to fracture. as far as the epidemiology is concerned, so if you see globally, the prevalence of osteoporosis was reported to be 18.3. Among women, it is 23.1, and men, it is 11.7. So in India, overall prevalence of osteoporosis was 18.3%, which was estimated in a mean age of women 47.8 plus minus 14.2 years. And across East, it is the prevalence is found around 18.4%, in the West 16.3%, in the North 16.4%, and in the South India it is 20.7%. Prevalence of osteoporosis was slightly higher in female than male, and the ratio is 19.4 versus 17.3%. Among post-menopausal women, overall osteoporosis prevalence was 33.1%, which is ranged in North region, it is 16.9% to 21.8% in the South region. And the prevalence of osteoporosis, it was higher in elderly, having age more than 60 or equal to 60 years than adults, which is in the ratio of 37 versus 12.5%. And if you see in Punjab, the prevalence of osteoporosis and osteopenia, it was observed to be 30.50 and 44.20% in the postmenopausal women. Next, please. So next is the bone remodeling. As we know that bone remodeling occurs throughout life. And at a given time, different sites on the bone surface will be in different stages of the remodeling process. And these are the 4 stages through which the bone remodeling takes place. So first one is the activation stage. Here the cells on bone surface retract. Second one is the resorption stage. Here osteoclasts remove bone, forming a resorption pit. And formation stage, osteoblasts fill the pit with new collagen matrix. And in the mineralization stage, matrix is mineralized to form new. So this is a bone remodeling takes place. So next one is the pathophysiology of osteoporosis. So as far as it is concerned, it occurs when osteoporosis occurs when normal balance is upset and bone resorption exceeds bone formation. So this results in a net loss of bone tissues with associated changes in bone architecture. So as you can see in the pictures also given below. So such an imbalance can occur with onset of menopause, where estrogen level decrease leads to excessive bone resorption, which is not fully compensated by an increase in the bone formation. So next, as far as the classification is concerned, it is classified into 2. One is primary osteoporosis and next one is the secondary. In primary, it occurs in women after menopause and in men later in life. But it is not merely a consequence of aging, but of failure to develop optimal peak bone mass during childhood, adolescence, and young adulthood. And in secondary osteoporosis, it is a result of medications or other conditions and disease that affect bone metabolism. And there are some rare type of osteoporosis is there, which are of 2 types. One is osteogenesis imperfecta. It's a group of genetic disorders present at birth that alter the development of collagen in bone, causing bones to break more easily. So effect of this condition range from relatively mild to severe and life-threatening. Other symptom of mild type includes a bluish tint in the eyes and early hearing loss. And next one is the idiopathic juvenile osteoporosis. It occurs in children during period of growth, typically between age of 8 and 14. Next slide, please. No, previous slide. Go to the previous slide. Next. So osteoporosis can cause any bone to affect. So there are 3 most common sites for fractures to occur. One is spine, next one is the wrist, and next is the hip. So these are 3 more common sites which are prone to get fracture when osteoporosis is there. Next. Next slide. Next comes the risk factors. So risk factors are as we know that females, they are more prone to have osteoporosis than male. So the ratio is 1:3. For 3 female, there is a 1 male, which are affected with osteoporosis. Next risk factor is postmenopausal women. And next, if there is a family history of osteoporosis, lack of exercise, small body frame, low calcium intake, vitamin D deficiency, and women or men if they are having a history of smoking. And as far as age is concerned, this osteoporosis starting in the mid-30s, but more likely with the advancing age. Even persons suffering with rheumatoid arthritis, hyperthyroidism, hyperparathyroidism, hypogonadism, mean in which the testosterone is low. And with certain medications, if the person is taking like corticosteroids, in which prednisolone, excess thyroid hormones, some diuretics like Lasix, anticonvulsants like dilantin, phenobarb, and tegretol. So these all are the risk factors. There are other risk factors also which make the person too prone to that osteoporosis. Other risk factors like hormonals. So under hormonals comes if there is a late menarche or early menopause. Early menopause means if the menopause occurs before the age of 45, or if there is a removal of ovaries before the age of 45, then also women are more to have this osteoporosis. And if she is on long treatment of oligomenorrhea, then during menopause, estrogen deprivation is there, which leads to increased bone resorption, and this further eventually leads to bone loss. If there is a malignancy, osteomalacia, hyperparathyroidism, and lack of weight-bearing exercises, vitamin D deficiency, glucocorticoid exposure. So in this case, it leads to decreased calcium absorption in the intestine, which causes increased bone resorption and reduced bone formation, and thus eventually leads to bone loss. Next are the causes. So under the causes, first is the genetics. So it is more common in Asian, white men and women. And as far as the age is concerned, up to 30 years of age, osteoblast is more than the osteoclast. Meaning bone formation is more than the bone breakdown. As the age become more than 30 years, so osteoblast become equal to osteoclast. And after 50 years of age, osteoblast increases and osteoclast increases and osteoblast decreases and osteoclast increases. So because of that, it results in osteoporosis. Other causes are like nutrition. So if the person is having a low calcium intake, low vitamin D intake, high phosphate intake, or inadequate calories, like some women, they are having a habit of doing in excess dieting, or even if there is a anorexia nervosa, so they become prone to this type of problem early in their age. And next is the lack of physical exercises and lifestyle choices, like having a habit of taking too much caffeine and alcohol, smoking, and lack of exposure to sunlight, which further reduces osteogenesis. And medications like intake of corticosteroids, anti-seizure medications, heparin, thyroid hormone, which affect calcium absorption and metabolism. So next, please. So next is the clinical manifestations. So as far as the clinical manifestation is concerned, if you see the overall clinical manifestation, there will be a loss of height, getting shorter by an inch or more, change in posture, stooping or bending forward, and shortness of breath. And that is because of smaller lung capacity due to compressed disc, bone fracture, and pain in the lower back. Whereas a sign and symptom of early stage osteoporosis, in this case, there will be receding gums and weaker grip strength and weak and brittle fingernails. And in the later stage, loss of height and fracture from a fall, then kyphosis, which causes kyphosis. In this case, the posture will become stooped and the compression, because of compression of the vertebra, so it causes slight curving of the upper back, and stooped back is known as kyphosis, which can cause back and neck pain. And even it can also affect breathing due to extra pressure on the airway, which limit expansion of lungs. And if you see the hormones, so there will be decreased calcitonin, decreased estrogen, and increased parathyroid hormone. So all these conditions leads to fracture. So these are the clinical manifestations which are very common to found if the woman is having a osteoporosis. Next slide. Approach to patient mean how to diagnose the patient. So for diagnosis of the patient, first we must take the history, routine history of physical examination and medical history should be taken. So everything, whether there's a history of smoking, well, taking alcohol, or regarding the nutritional status and everything. And then should go for routine lab evaluation. And next one is the examining of calcium in the urine. So if it is low, mean less than 50 milligram in 24 hour urine collection, if it is less than 50 milligram, so that is indication of osteomalacia, malnutrition, or malabsorption. And if calcium in the urine is high, that is more than 300 milligram per 24 hours, so it is indicative of hypercalciuria. And serum 25 hydroxy D level, that is again the level of vitamin D. So the normal level, it is 20 to 40 nanogram per ml. So if it increase or decrease, if there is a deficiency of this, if it is less than 20, that means the woman is prone to have osteoporosis, even maybe in the early stage of life. Hypothyroidism should be evaluated by measuring thyroid stimulating hormones.
Excuse me, Pravesh ma'am.
Metabolic bone diseases, bone biopsy. Next slide, please. So as far as the biochemical markers of bone metabolism is concerned, which are used in the clinical for bone formation as well as to assess for the bone resorption. So for bone formation assessment, serum bone specific alkaline phosphatase is assessed, serum osteocalcin, and serum propeptide of type 1 pro collagen. And for bone resorption, urine and serum cross-linked and telopeptide, urine and serum cross-linked C-telopeptide, and urine total free deoxypyridinoline. So these are the biochemical markers of bone, so which are assessed to check for the osteoporosis. Next, please. So this is bone densitometry. So this is a way of measuring the amount of calcium in a certain amount of bone. And this is important.
Excuse me, ma'am. Excuse me, ma'am.
Yes, yes.
Am I audible, ma'am?
Yes, you are audible.
I'm sorry, ma'am. But please, ma'am, on your video, it's not visible. You are not visible.
I am not visible.
Yes, ma'am. Your video is off, actually.
My video is off. But
Along with this mute and unmute button, there is start video. Kindly on that one. Click on the start video.
Stop video is there. I don't know start video where it is.
Screen is visible, ma'am.
Screen is visible, na? And am I audible or not?
Yes, ma'am, you are also audible.
Only
Yes,
my
ma'am, you're audible.
Picture is not coming. Your
only
face-
my picture is not visible.
Yes, ma'am. Yes, ma'am.
So that's okay. I have already started this video. I don't know why it's not coming.
Okay, ma'am. It's okay.
Continue, ma'am. No
Please
problem.
produce. Yes.
Okay, so then next is the bone densitometry. So this is a way of measuring the amount of calcium in certain amount of bone. So, and this is important because the amount of calcium in your bone only determine how strong it is. And if the bone density is very low, then you have osteoporosis and a very high risk of fracturing your bone. A standard X-ray is not a good way to measure bone density because you must lose about 30% of your bone mass before it can be detected this way. That's why the most advanced test which is done is called dual energy X-ray absorptiometry, which is in short term it is called DXA. Next slide, please. So this is how the DXA is taken. This test is taken to assess for the osteoporosis. Next, please. So it is a simple test that measure bone mineral density. Often the measurements are at your spine and your hip, including a part of the hip called the femoral neck at the top of the thigh bone. The test is quick and painless, and it is similar to an X-ray, but uses much less radiation. But if the woman is pregnant, then she should not have this test to avoid any risk of harming the fetus. Next, please. So, and this DXA test results are scored with T-score, and the normal value is -1 and +1. So here, if it is DXA T-score, if it is not lower than -1, that means person is having a normal BMD, and if it is between -1 and -2.5, that means osteopenia is there. It is mild BMD is there. And if the mild BMD is there, that there is not a risk of fracture. But if it continues, if bone loss is continued, then risk of fracture increases. And if it is -2.5 or lower, then that means the person is definitely having a osteoporosis. Next, me. Next is the treatment. So in the treatment part, first is the nutritional recommendation. So nutritional recommendations which are required to overcome this osteoporosis is young children 1 to 3 years of age, the recommended calcium intake milligram per day is 500. Older children 4 to 8 years, it is 800 milligram. Adolescent and young adults 9 to 18 years, it is 1300. Men and women 19 to 50 years, it is 1000. And men and women 51 and older, it is 1200 milligram per day. Whereas vitamin D is concerned, so adequate amount of vitamin D, so it should be taken, and it is important because it is important for the absorption of calcium from the food, from the intestine, whatever food you have eaten. And the recommended daily dose is 400 to 800 international unit for adult younger than age 50, and 800 to 1000 IU for those age 50 and older. Next slide. So with the medications, how it is treated, so that were the dietary. So how with the medication we can treat it. So genetic drug names are, first is alendronate. So this is used for prevention and treatment of postmenopausal osteoporosis in women. So treatment of OP due to use of glucocorticoid medicines. And this is taken once daily or once weekly pill. Second one is ristronate. It is also used for prevention and treatment of postmenopausal osteoporosis in women. And this is also due to the use of glucocorticoid medicines. And it is also taken once daily, once weekly, or once monthly pill. Ibandronate, that is also for prevention and treatment of postmenopausal osteoporosis in women. And once monthly pill or every 3 months by intravenous infusion. And zoldronic acid. So this is also for prevention and treatment of postmenopausal women if they are if they are on glucocorticoid medicine, and it is taken once in a year by IV. Next, please. Next medicine is calcitonin. So this medication is this medication is a hormone made from thyroid gland, is given most often as a nasal spray or as an injection shot under the skin. And this is approved for the management of postmenopausal osteoporosis and help prevent vertebral or spine fractures. And it is also helpful in controlling pain after an osteoporotic vertebral fracture. Next one is the estrogen or hormone replacement therapy. And for getting this therapy, so one should consult doctor whether it is right to get or not, because the woman is having some problems, it may not be, it may be contraindicated. But estrogen treatment alone or combined with another hormone like progestin, so if it is given, it decreases the risk of osteoporosis and osteoporotic fracture in women. But one must advise to the women that it should be taken for a shorter time and very low dose. Otherwise, it can have its side effects. Like even breast cancer also women can have later on. Next slide, please. Then next one is a selective estrogen receptor modulators. This is not estrogen, but this is like a estrogen, which have its effect on the bone without some of the serious side effect, like breast cancer, which can have if we take a estrogen hormone. Next one is a teriparatide. So teriparatide, it is a form of parathyroid hormone that helps stimulate bone formation. It is again an approved. It is also approved for use in postmenopausal women and men at high risk of osteoporotic fracture. It also is approved for treatment of glucocorticoid-induced osteoporosis. If somebody is on glucocorticoid, means on hormone treatment, so then in that case also it's helpful. And it is given as a daily injection under the skin and can be used for up to 2 years. So next is exercises to make the bone stronger and to prevent osteoporosis. So exercises are weight-bearing exercises and muscle strengthening exercises. So in the weight-bearing exercises, next slide, please. So there are some high-impact exercises and low-impact exercises. So under high-impact comes so women should be encouraged for dancing, high-impact aerobics, hiking, jogging, running, jumping rope, stair climbing, playing tennis or volleyball, etc. And under low impact exercises comes the elliptical training machines, stair step machines, low impact aerobics, walking on a treadmill, walking on level surfaces. So women should be encouraged to do such type of exercise, even simple walk. So that is also helpful to strengthen the muscles and to help the women from to prevent osteoporosis. Next, please. And if somebody gets the osteoporosis, then how to live with it? So to live with the osteoporosis is firstly using a walking aid. So if a woman is very unsteady, so she should be encouraged to use cane or walker, and tell them to remove hazards in the home, like if rugs are there, remove them or throw them out, and also remove or secure loose wires at home or cables that may make you trip. And add night lights in the hallways leading to the bathroom. Install grab bars in the bathroom and non-skid mats near sinks and the tub. So this is all to avoid fall. And next, while carrying or lifting heavy items, so she must get a help from somebody. If she is not careful, if you are not careful, you could fall or even suffer a spine fracture without falling. And women should be encouraged to wear sturdy shoes, even at home also, inside home, and if it is winter or rain, so during that time, so it is must to wear so that she should not have a fall and she can prevent herself from having the fracture. Next, please. So there are some nursing interventions which can be helpful for the women, like promoting understanding of osteoporosis and the treatment regimen. So women should be educated and health education should be given to all the women nearing to menopause, and even before that also, regarding the what is osteoporosis and what type of treatment, and not only the medicine but other without medicine. So what are the things which they can do, like exercises, etc. So they must be encouraged to do so that we can prevent them from having a fracture later in their life. Then if they have some kind of pain, so for that also analgesics can be given, or otherwise advise the patient to rest in bed in a supine or side-lying position several times a day. And the mattress which they use should be firm and non-sagging. And even tell them that knee flexion, it also increases comfort. So they must flex their knees in between. So this is also, and even in between doing the activity, she must have a rest. Then intermittent local heat and back rubs because it promotes muscle relaxation. And the nurse should encourage good posture and teach body mechanics to the women. Next one is improving bowel movement. For that also one must be very careful, because this is a stage where most of the persons, they can have this constipation also. To prevent or minimize constipation, so they must be advised for early institution of high fiber diet and to increase the fluid intake and even to use prescribed stool softener. Then preventing injury, the nurse encourage walking and good body mechanism and good posture, plus daily weight bearing activities, which is must, and especially outdoors. That is mainly to enhance production of vitamin D. So these are the references which I have used to collect the content of this. And there are many other nursing measures also. If the person is having even I have not gone through if the person is having a breakdown of bone and there are surgeries, so that is not a part of my. So then person has to undergo like hip replacement surgery and all, and a fracture, because I have told you that wrist, hip and spine fracture is more common. So one has to be careful and prevent yourself from getting fallen. So this is all.
Please unmute.
What
Please
is this,
unmute.
beta?
So that's all.
You're coughing on my roti.
Anybody having any?
ਵੀ ਇੰਨਾ ਕੁ ਤਾਂ ਅਕਲ ਤੈਨੂੰ ਸਿਖਾਈ ਹੈ ਮੈਂ
ਕੋਈ ਮੈਨਰਸ ਨਹੀਂ ਹੈਗੇ ਇਹਨਾਂ ਨੂੰ ਯਾਰ ਲੱਗਦਾ ਸਕੂਲ ਪੜ੍ਹਦੇ ਹੀ ਨਹੀਂ ਤੇ ਡੰਗਰ
Please unmute yourself. Audience, please unmute. Sorry, ma'am.
Video is not starting. I do not know. So this is all about osteoporosis. So let me summarize. So what is it? What are the causes and what are the risk factors, pathophysiology and diagnosis by. And there are some tests like the main test which is done is DXA and then all the preventive measures. So I have discussed. So any question, any query?
Thank you so much, ma'am. Thank you so much, ma'am. As I can see in the chat box, there is no query, and you have already explained very nicely about the introduction of osteoporosis, epidemiology, and different causes, and also about the diagnostic tests, especially DEXA scan, treatment, and different exercises. And you have covered nicely all the aspects of this problem, so there is no query in the chat box. So thank you once again, ma'am, for your outstanding presentation and also for sharing your precious time and experience with us. Thank you, ma'am. Now, I would like to hand over to Surinder ma'am to proceed further. Please,
Thank you very
Surinder ma'am.
much.
Yes, ma'am. Thank you, ma'am. I thanks to Dr. Raman ji,
Welcome, ma'am.
to hand over to control the scientific session, and Professor Parveez Saini ma'am to brief explaining regarding the osteoporosis. I thanks again to both of you. Now I am handing over the control of this webinar in hand of Dr. Taranpreet Kaur, Professor cum Principal, Baba Banda Bahadur College of Nursing, Faridkot, Punjab, for vote of thanks. Ma'am, please.
Actually, there was some question. There was a query, and they were asking about explain about calcitonin again. So, I want to explain it. This is a hormone from the thyroid gland, and it's good for the treatment of osteoporosis in postmenopausal women who cannot take or tolerate other medication for osteoporosis. So, this is the answer for that.
Okay, ma'am. Thank you.
It was displaying us. That's why.
Yes, thank you, ma'am.
Thank you, Surendra ma'am. Good evening to everyone and one present over here, guests and resource person, Dr. Parveez Saini, moderate Dr. Ramanjeet ma'am, NTI executives, Punjab State NTI designated members and all participants. It is such an honor for me to get the opportunity to thank you all dignitaries on the behalf of NTI Punjab. It is gratitude is a sign of noble souls. Today, I don't have enough words to express my gratitude. An event like this, dimensions can't happen overnight. The wheels start rolling days in advance, and we have been fortunate enough to be backed by a team that is full of motivation and dedication. Thank everyone enough for the involvement that all have shown and willingness that express to take the completion of tasks beyond their comfort zone. I would like to express my gratitude to all esteemed delegates of the webinar for their presence and contribution to make this webinar a great success. My extended gratitude to our moderator, Dr. Ramanjeet Kaur, and Honorable Resource Person, Dr. Pravesh Saini, to take out their time from their busy schedule to grace the event and increase our knowledge. Thank you for inspiring and encouraging words and providing immense support to make this webinar successful. My sincere thanks to the national level executive members of NTI, who all have shown the faith in Punjab State NTI branch. My precious gratitude towards the Punjab NTI President Dr. Hardeep Kaur and her noble team, who accomplished the work in an honorable manner. I must thank organizing team volunteers for the working hard. I'm thankful from the bottom of my heart to all the participants of the webinar. Once again, thank you very much.
Thank you.
Thank you, ma'am.
Dr. Taranpreet ma'am. Great thanks to everyone again. We appreciate you being here. Thanks again for accepting our proposal and joining us today. We will see you the next time. Thanks the all NTA Punjab branch and team members.
Thank you. Can we leave now?
Yes, ma'am. Thank you.
Okay, thank you so much.
Thank you, everyone.
Yes.